Probably the most common thing that I'm going to see as I get older, my patients tend to get older. And what is a ubiquitous problem when you get older is you don't urinate like you used to and your prostate grows. And we call that BPH. So that's probably even more so than prostate cancer and other problems. I probably see enlarged prostate problems more than anything else. I think my approach to those problems is probably not entirely unique, but it's somewhat unique. I always insist on a stepwise approach. So the first thing is to reassure the patient that it's not something else like prostate cancer, which it hardly ever is. If the patient's bothered enough that they want to be treated, I'm always going to try medicine first, even if the patient doesn't necessarily want to be on a chronic medication. We're going to try it and give them a chance to see if that's going to be the answer for them. Where I might differ from other urologists would be if that medicine fails. I'm usually very upfront and honest in stating that commonly if one medicine fails, two medicines aren't really going to be better. The other place that I'm relatively unique is that when one medicine fails, I make it clear that this is a progressive problem. It's going to get worse. So after one medicine fails, I will at least offer to fix the problem with an in-office technique or in-office procedure. I don't usually jump to more aggressive procedures. I want to try medicine, and then I want to try an easy office procedure, and if that fails, we can always move on to something in the operating room. Obviously, the success rate of things goes up as we go up this chain, but I have very few patients that are on two medicines plus perhaps an herbal remedy, because most patients, when they understand the progressive nature of this, are going to choose more of a fixing approach versus an ameliorating approach. And these procedures are very simple, are relatively low risk, and most of my patients will choose to do those.